in the respiratory system, the lower respiratory tract, which means the trachea, the air pipe extended to the lungs, are the very common areas for infections. Most oftenly it starts with upper respiratory tract, later on it extended to the lower respiratory tract, which means that with the commonest presentation for the people is the cough. There are two types of cough we clinically see. One is the dry cough, when we have a cough with a diaphragmatic push and we try to push the things out, but there is no mucus comes in. There is another type of cough which is called mucus cough, where we expectorate. Whenever we make a cough, there are a lot of mucus things come from the trachea, comes to the mouth, and we are able to spit it out in a proper way. So this lower respiratory tract is very highly vulnerable due to the different climatical change, also related with some lung diseases. For example, nowadays we have a COVID issues where large number of people get affected with the lung problem, and lower respiratory is one of the most vulnerable area to have this. So what happens is that when we get a disease, especially in the respiratory system, body will try to respond to that. So in the trachea, the air pipe, there will be lot of secretions comes, which creates a mucosal layering inside. So initially it may be a small amount of things, and whenever we take food, whenever we take other things, this type of mucus may get melted and somehow it is spit it out. But if it goes for a longer duration, we will start getting a sort of difficulties called breathlessness. That means whenever we do small exertions, maybe walking few steps, maybe climbing 1 or 2 floors, the person will feel very exhausted. Maybe carrying a suitcase in the train, you are traveling maybe 500 meters of pulling a trolley in the railway station, catching the train, person will feel exhausted. So this is a typical sign. Breathlessness is a very typical sign, often starts with the lower respiratory tract. So we feel that a sort of congestion. Even after some time of this breathlessness, we feel fatigue, we feel very sleepy and things. And later on, this will manifest with cough. That means that the lungs trying to push the whole mucosal content or the infectious things, put it out from the body. This is very common. It starts, the cough itself will have different type of manifestation. One may be a dry cough, which is oftenly maybe response to the particles in the trachea. So we cough it and the mucoses will go off and we feel comfortable. But there are other type of cough called allergic cough. So we inhale lot of allergens. It may be some food, it may be some particles from the air, and this will create an allergy to the trachea or the air pipe and start mucosal secretion, and we'll have a cough to push this mucus out. But it will not happen. So we will have a continuous response to the trachea problem. And for this, one of the commonest thing what we should do is that whenever there is a mucosal secretion in the trachea, there are often it will shrinks. So we have to expand that air tube. The simplest way, take a sarshabatailam or kadiganna, which is called a mustard oil, take it, apply little on the chest or in the back, make a small fermentation on the chest will be very, very beneficial. Even simple inhalation of the steam, taking a steam machine, add little plants like tulasi or any plant which is having aromatic oil, or we can add any natural things also, and inhale that steam very deeply, also will help the trachea to expand, all the mucus will come out. But this will work only for the short duration. But if the problem is continuous, going for larger infections in the trachea or infections to the lung, we have to have a strong medicines. In Ayurveda, we use different type of arishtas like Dashamula arishtam is there, Abhaya arishtam is there, Vasha arishtam. There are many Ayurvedic preparations are there which can be very beneficial. So whenever lungs related problems are there, we have to take medicine for multiple times, 4 or 5 times. Like we have Dashamula Rasayanam, we have Shwasajeevanam Leham. There are many Agastya Rasayanam, many well-known respiratory protective medicines are then in Ayurveda, which is also will be very beneficial to take out this mucus and improve our immunity. Lung capacity is a very, very vital things whenever we need to do any exercise, whenever to do any activity. So keep the lungs protect, because it is the best system that connect to the whole other systems through the air from the environment. So we have to keep the lungs immunity very powerful by using different type of rasayanas in Ayurveda like Chayanaprasham, Kushmanda Rasayanam like medicines. So, that will also be very helpful for long term lower respiratory tract infections. But if it persists for few more weeks, better to consult an Ayurvedic doctor and identify what is the problem and which are the areas of the lungs are affected, and take the best prescription from him.